to this press press conference. I've been asked today to give some background as to the scene on the overall death and the way people die throughout the world. I have the privilege of working with a group of colleagues from many countries around the world. The Worldwide Palliative Care Alliance has got over 60 members. From 60, I think 60 to 70 countries which are members of the alliance, and what we try to do is to empower our members to advocate for better palliative care around the world. I'd like to talk about the findings in the white paper. And I'll go through the executive summary, which I think really gives quite a good summary of what the index tells us. The UK was the country where palliative care started. And palliative care is a relatively new field. It's less than 50 years old. We date our starting to 1967, when St. Christopher's Hospice was opened in London. So it's not surprising that the UK leads the world in terms of ranking, according to this index. I would have been very surprised if it didn't. Although what's not so surprising is that Australia comes a very close second. And those are countries where palliative care is best developed. And why is it best developed? When you look at it, a lot of the weightings of that is due to the fact that there is government policy. They have national end-of-life strategies, and that has raised a lot of awareness among policymakers and so on. But that doesn't mean that public debate is that common even in those countries. POA has said that one of the barriers to progress in this field is the cultural taboos surrounding death. Nobody wants to talk about it. And it's not only just our Asian populations. This sort of thing is worldwide, even in Western populations. It's just that when you have people advocating, you have publicity like this index on quality of death, and you have government support, that you can actually make some progress in terms of how we care for the people who are dying. Most of probably the most important practical issue that we need to move on is the availability of drugs to control pain. So many of us fear death, not because we fear the actual event, but we fear the process of dying. And many people associate death with pain. When the index was made, one of the weightings on whether you give good end-of-life care is whether strong drugs that control pain, the opioid group of drugs, are available in that country. Now, the World Health Organization supports, requires countries to make available opioids for medical use in all the countries that have signed onto this international treaty. Unfortunately, governments are very, very scared, and they've put on a lot of rules and regulations to prevent illicit use, to prevent trafficking, and to prevent addiction. And yet, governments have not done enough to make the drugs available for medical use, which is the other half of the treaty that the World Health Organization requires their signatory countries to do. So currently, over 50 billion people are unnecessarily suffering pain towards the end, not only towards the end of the life, but throughout, because their countries do not have enough opioids. So one of the areas where we really need to work worldwide is to make sure that government policies and the interpretation of those policies reach all the way down to the patients, so that these essential tools for making life better, improving quality of life, whether it is at the end of life or earlier, are available to doctors and to their patients. The other thing about improving palliative care is improvement of state funding. Many countries rank highly in the index because of state funding of their general healthcare system. Now, if palliative care has been integrated into the healthcare system, then obviously it will also be funded by the government. So one of the things that we push for is that palliative care should not be only funded by charities, which it is being done in most countries in the world. It's always started by charities, but in many countries it remains funded by charity. So government funding, government policy on these issues is very important if we want to make progress. Some of the arguments that we use with governments to say why they should fund palliative care and care at the end of life is that there is some evidence to show that you can actually reduce healthcare spending by preventing futile treatments, futile investigations, hospitalizations that do nothing but decrease the quality of life rather than improve the quality of life of this group of patients. But there is a certain amount of opposition here. The public still perceives that by embracing palliative care it means giving up. That is not the case at all. Palliative care does not exclude us from having cancer treatment, other treatments for chronic diseases, and so on. I think some of the government funding, notably in the US, forces people to choose between having hospice care and having cancer treatment, for example. I think some of those policies are outdated. Unfortunately, many other countries' situation is not like that. I think the one thing that really brings the whole field forward is when there is a national policy, a national strategy for end-of-life care. And those countries that do really well in the index have got national policies. And yet it's just a handful of countries, as you can see from the report. Lastly, I'd like to mention that people might think that palliative care is all about putting people in institutions, hospices and such like. But that is not the case. If we want to reach the population, if we want to reach all of the people who need palliative care, we really need to go into the community. And those countries which give you the best coverage of palliative care are those countries where the community is involved and care is given in patients' homes. Not only is this the most cost-effective way of providing palliative care, it also is what the patients really want. Most people, if you ask them in different countries of the world, want to be cared for at home, in their own homes, towards the end of their lives, surrounded by their loved ones. So I think that is a perception that we need to combat. And also, it's a challenge to all of our communities. There are examples within the white paper which shows you communities where it is possible to mobilize the general public so that care is provided for as many people in the community as needed. But I think in many countries we have to follow these examples. And I'd like to stop there. Thank you.